we have not taken our eye off the ball of focusing with intentionality on addressing the needs of the most vulnerable Californians, particularly those out on the streets and sidewalks. So many struggling with physical disabilities, so many struggling with emotional disabilities, many self-medicating, drug or alcohol addictions, bipolar disorder, schizophrenia, paranoia, many families torn asunder because of the inability to pay rent, and others through no fault of their own, victims of circumstance and end up in encampments, end up on streets and sidewalks, in congregate facilities, shelters, large and small, all across the state of California. That issue has always been top of mind in terms of our administration and our approach in the state of California to take ownership and to recognize that this state has failed to address the issue of homelessness in a meaningful way. We made a commitment to you over a year ago that we were going to engage in ways we hadn't in the past to help support counties, help support cities, large and small, to address the stresses and the challenges that they face as it relates to addressing the issue of poverty in all of its forms and manifestations, but primarily as it relates to the issue of homelessness. Last year, we put out a record amount of money to cities and counties and regions to help support their efforts, but we recognized it wasn't just about money. We needed a more resourceful mindset in terms of addressing the issue. And that required us to take a different approach, a different framework of collaboration. Accordingly, I set forth at the beginning of this year my State of the State, and I decided to take the entire State of the State address and make it about one issue, the issue of homelessness, issues related to homelessness, issues related to brain health, mental health, broadly defined, taking a look back, our history, our past, present, and where we wanted to take this state into the future. We made some bold commitments in our January budget, and no sooner did we make those commitments, then self-evidently we started to address the issues of this pandemic. As late as January, early February, repatriation flights into the state of California, a cruise ship off the coast of California into the San Francisco Bay Area, into the Oakland port, and obviously a pandemic that transcends the borders here in this state, our nation, and the rest of the world. Nonetheless, we worked very collaboratively over the course of the last number of months through this crisis to, again, focus with intention on the needs of our most vulnerable Californians. And despite all those headwinds, despite all those changing circumstances, we were resolved and we were committed to figuring out a different strategy, a new way to actually produce real results. I've long said the future is not just something to experience, it's something to manifest. It's our decisions, not conditions, that determine our fate, our future. So we resolved to make new decisions based on changing conditions. And we originated a program, first of its kind, first in the nation. We referred to it as Project Roomkey. It was a simple idea, working with our federal partners, working with FEMA primarily, to address our approach to this pandemic. We recognized we needed to do much more to address our most vulnerable Californians that were out in these congregate facilities, out on the streets, sidewalks, and in large encampments all across the state. The prospect of the spread of this disease, the prospect that this disease would spread to people with underlying health conditions, self-evidently presented itself as an opportunity, but also as a challenge for this state. Accordingly, we worked with FEMA to develop a partnership under Roomkey that allowed us to move forward to procure hotel rooms, motel rooms like this here in Pittsburgh, where we can get people off the streets, out of encampments, out of homeless shelters, out of their cars, Winnebagos or maybe their neighbor's couch, and get them the privilege of a key, a lock, a place to call home, and begin to support their recovery, support their return, and their opportunity to transfer back with more independence by providing support services. Project Roomkey was born just a few months ago, remarkably just in April. Here we are a few months later, and we've reached some really, I think, significant milestones. We took an idea, pen to paper, and today we have 15,679 rooms that we brought in under our portfolio. 15,679 rooms. We estimate 14,200 individuals. Again, the numbers are, forgive me for stumbling over the numbers, I couldn't be more proud of an effort just in a few months to get 14,200 individuals off the streets, out of encampments, and into units like this. 85% of the occupancy for the units that we've set aside for asymptomatic, high-risk homeless individuals are now occupied. We're here at a facility, 131 rooms, almost every single one of them occupied with over 164 individuals behind these doors, getting support services, getting 3 meals a day, getting the support of incredible leaders like Ivana Martin and her team that embraced this program that is locally driven. State identifies the asset, provides the capacity to get reimbursed from the federal government and get support from the state of California. But at the end of the day, this program doesn't work without outstanding local officials doing the job. And she has done a magnificent job with Supervisor Glover and others that have been out there championing her efforts, supporting them, and demanding more, and demanding people in positions like myself to do better, to be even more supportive to the counties, including Contra Costa County. So we're proud of the progress. Just in a few short months, 14,200 individuals, we estimate, now out of the conditions that made them vulnerable, now in conditions that give them a little bit more security and give us a little more confidence that we can make a difference and we can make real progress in addressing the issue of homelessness in this state. That's the progress to date on Roomkey. But what I want to announce today more substantively was the progress we made just yesterday. I signed a budget to address a $54.3 billion budget shortfall. Signed it yesterday afternoon. Through intense negotiations over the course of the last few months, the legislature and myself, we came together around a framework despite an unprecedented shortfall in such a very focused or short period of time. Again, $6 billion projected budget surplus 100 plus days ago to a $54.3 billion budget deficit that we had to balance. Unlike the federal government, we have to balance our budgets. We were able to sign a balanced budget yesterday, but it did the following. It provided an additional $1.3 billion to cities and to counties to support programs like this, meaning despite the deficit, despite the headwinds of stress that we had to address in balancing our budget, we still made a commitment to lean forward, lean into future, follow through on our commitment to do more and do better for homeless Californians. $900 million of that comes from the state itself. $550 million specifically for acquisition, not just leasing of units like this, but acquiring units like this. And I think this is rather significant. And forgive me again for belaboring this. If I appear to be enthusiastic, it is because I am. For years and years and years, as a former county supervisor myself, a former county mayor, to have the resources to purchase assets like this that would allow us to immediately get people off the street permanently. The reason I longed for that opportunity is we all recognize in the state of California, those of us in the county level and the city level, the cost and the time value of money to procure a site, to get the funding, to acquire the site, to get it set up, to do the entitlement process, to get it built, to get it occupied. 3, 4, 5 years go by. And at the end of the day, the price tag in LA right now, it's about $500,000 per key, per unit. So you start doing the math, 3 to 5 years, $500,000, and you have one unit. If we're going to solve the magnitude of this crisis, 100,000+ people in the state, we've got to do something faster with more intention. We've got to do something much more aggressively, differently, dare I say. And so this acquisition portfolio, this pool of money, this $550,000, provides this flexibility for the supervisor, for the Health and Human Service teams, for the counties and cities to procure assets like this, $550 million. We also put additional resources into the hands of the counties, over $300 additional million, 350 to be exact, that allow the counties to help support the services once units, motels, hotels, tiny homes, prefab homes, vacant apartment buildings are purchased, that will allow the services to go on site. Because one thing we know, we don't think this, shelters solve sleep. Housing and supportive services solve homelessness. And that's the framework of what we now refer to no longer as Project Roomkey, which was our emergency frame, but now Homekey. A sense of permanency, a sense of place, a framework of opportunity to anchor the progress we made in the midst of this pandemic and have something very meaningful to show for it moving forward. So $1.3 billion, $900 million from the state, money coming from the CARES Act, and additional philanthropic resources. And I'd be remiss if I did not thank Blue Shield and Kaiser for $45 million in funding to help these efforts to provide supportive services for programs like this as well. So we're very proud to make this announcement today. I'm very proud of the leadership here at the local level. 293 hotels like this have been procured in our portfolio in 52 counties in the state of California. Again, 15,679 rooms, over 14,000 individuals now with a dignity of place to call home, and a program that is not permanent, Project Roomkey, but continues to be extended on a month-to-month basis through this crisis. And we have no expectation that FEMA will walk away from their commitments anytime soon. I'd be remiss, by the way, if I didn't thank Bob Fenton of FEMA, who's just been an extraordinary leader, the regional director of FEMA, whose ingenuity, his entrepreneurial spirit, you talk about the good ones in government, this is one of the best. And it was because of his willingness to work with us that we created this program. And now, interestingly, I picked up the paper the other day, Connecticut's trying to replicate this program. Hawaii is trying to replicate this program. Now other states are looking to replicate this same program, which we're very, very grateful for and very, very proud of. So I wanted just to share that with you at the top of my presentation. But as always, the purpose perhaps for you tuning in to this presentation was to hear the updates on where we are as a state related to COVID-19, total number of positive cases, total number of hospitalized, total number of ICU cases. So let me briefly just update you on the current numbers in this state. In the last 24 hours, we had 6,367 individuals, 6,367 individuals that tested positive for COVID-19. We have seen an increase of the total number of positive cases rather consistently over the course of the last 2 weeks here in the state of California. In particular, concern is the issue of the number of hospitalizations and the number of ICU patients in this state. Hospitalizations yesterday increased some 6.3%. Number of ICU patients increased 4.3%. I referenced the 6.3% and the 4.3%. Yesterday, I noted that over a 14-day period, we've seen a 43% increase in total hospitalizations in the state, a 37% increase over a 2-week period in total number of ICU patients. So we're seeing an increase, a steady increase in not only total number of positive cases, but total number of hospitalized patients and total number of patients in our ICUs. Accordingly, we showed a slide yesterday, and I want to reinforce it again here today. We had a 4.4% positivity rate in this state 2 weeks ago. Remember, positivity rate is the total number of people tested and the total number, or rather percentage of people that tested positive. Our positivity 2 weeks ago was 4.4% over a 14-day period. Today, it's 5.6% over a 14-day period. When you look just at the last 7 days, it's increased to 5.9%. So that's a point of caution, point of consideration and obviously a point of concern. That led to the decisions we made over the weekend as it relates to shutting down bars in those areas of the state where we've seen an increase in the total spread of the virus, particularly community spread. We've also now included some 19 counties on our watch list. In full disclosure, it's likely to see an additional 4 counties on the watch list in the next 24 hours. I want to make this clear and preview. Tomorrow we'll be making some additional announcements on efforts to use that dimmer switch that we've referred to and begin to toggle back on our stay-at-home order and tighten things up. The framework for us is this: if you're not going to stay home and you're not going to wear masks in public, we have to enforce, and we will, and we'll be making announcements on enforcement tomorrow. But we also have to recognize that the spread when you're not at home in indoor facilities is much more probable than in outdoor settings. And so we'll be looking at a lot of the current stay-at-home orders, or rather we'll start looking at the health orders and health directives in the counties in relationship to indoor versus outdoor activities. As I said, that will come tomorrow. So again, please be vigilant. Please wear face coverings. Please practice physical distancing. I cannot say it enough. I said it last week. I said it yesterday. I'll say it again. We've got 4th of July weekend coming up. One of the areas of biggest concern as it relates to the spread of COVID-19 in this state remains family gatherings, not just bars, not just out in streets where people are protesting and the like. It's specifically family gatherings.